You have heard a lot about GLP-1 receptor agonist drugs, including Mounjaro, Ozempic, or Victoza, which are a miracle for diabetes treatment and weight loss. But today we will cover what they are, how they work, who they are for, and what to watch out for. So let's start. GLP-1 RAs mimic a gut hormone that regulates appetite and blood sugar. Since exenatide hit the scene in 2005, we have got a lineup of stars, including exenatide, liraglutide, semaglutide, dulaglutide, and tirzepatide. But how do they work and cause weight loss? GLP-1 RAs bind to receptors in three key areas: the stomach, the pancreas, and the brain. In the pancreas, they trigger beta cells to release insulin only when blood sugar is high, lowering glucose. In the stomach, they slow gastric emptying, so food moves slower, stabilizing blood sugar and keeping you full longer. In the brain, they hit hypothalamus to curb hunger signals. This triple action, including better insulin, slower digestion, and less appetite, drives weight loss, with trials showing 10 to 18% of body weight reduction for drugs like Ozempic and Mounjaro. Who are these drugs for? They are FDA approved for type 2 diabetes mellitus in adults to improve glycemic control. They are also FDA approved for chronic weight management in adults with BMI over 30 or a BMI over 27 with comorbidities like hypertension, type 2 diabetes, or dyslipidemia. Who should not use these drugs? Those with a personal or family history of medullary thyroid carcinoma or multiple endocrine neoplasia syndrome due to rare thyroid tumor risk in animal studies. Also, they should not be used in pregnancy or breastfeeding because of lack of data. Cautions should also be taken for those with a history of pancreatitis, gallbladder issues like gallstones or cholecystitis, patients with retinopathy, and hypoglycemia, especially in diabetic patients with other diabetes drugs. GLP-1 RAs are powerful drugs, but they have side effects. Common ones are gastrointestinal, including nausea, vomiting, bloating, abdominal pain, diarrhea, or constipation, especially when starting or increasing doses. These often ease over time, but there are several tips to manage them. Eat smaller portions, stop eating before you feel full, avoid fried, greasy, and oily foods, and stay hydrated. Serious risks include pancreatitis, which was said, and it occurs in fewer than 1% of users, and gastroparesis, which means delayed stomach emptying, which causes discomfort. GLP-1 RAs like Mounjaro and Ozempic are transforming lives, but pair them with exercise and healthy eating for the best results. Do not forget to ask your doctor to ensure that these drugs are safe for you. Got questions? Drop in the comment, hit subscribe, and ring that bell for more health tips. Stay empowered, stay healthy. See you next time.